the right treatment of epileptic seizures in dogs can ensure they live a full and happy life. Getting this wrong, however, has the consequences that can be heartbreaking. I'm Dr. Alex. I've been a vet since 2006, and in this video, I'm going to guide you through all of the main different treatment options for epilepsy in dogs, from our conventional pharmaceuticals to more recent additions and alternative options you might not yet have considered. Now, each option has its own benefits, limitations, side effects, and success rates, which I'm going to review here. But it's also really important to know that your dog's seizure history, along with general body and organ health, may also change which exact treatment option is best for your individual dog. And so the first treatment I'm going to talk about is phenobarbital or phenobarbital. Now, this drug comes in numerous different trade names, and it's probably the most commonly prescribed anti-seizure medication. It's been used to treat epilepsy in dogs for decades. Now, first things first, phenobarb is a first-line treatment. So this means that reaching for this option before any other pharmaceutical is completely appropriate. This is because when used alone with no other anti-seizure medication, phenobarbital is effective in reducing seizure frequency in 60 to 93% of dogs when plasma concentrations are maintained within the therapeutic range. So that means the amount of drug in the blood is at a range that we know should be working. And for those dogs where it is effective, studies have shown that 85% of dogs can become seizure-free for 6 months or longer. So that is a really successful outcome, and the ideal outcome that we hope for every single epileptic dog. Is also one of the cheapest options available, which is always a bonus. But of course, there are some important considerations here. The first is that it can take a week or so to reach effective blood levels. In terms of side effects, if they happen, they tend to be early after treatment started or that dose has been increased before then disappearing over the next few weeks. And these side effects include sedation, coordination, increased appetite, increased drinking, and increased peeing. More serious side effects are thankfully very rare. I've never seen them despite treating hundreds of epileptic dogs, but they can be serious and include liver toxicity and blood cell abnormalities. To complicate things further, the body can also begin to break down this drug more quickly over time, and it's for this reason that monitoring blood testing is recommended, as well, of course, to ensure that there are no serious side effects developing, no matter how uncommon they are. So these tests are looking at how healthy the body is, especially the liver, as well as ensuring the drug levels are where they need to be, so that the dose can then be adjusted as needed, considering too, of course, how well those seizures have been controlled. If the blood tests show the levels are potentially a little bit lower than the ideal range, but a dog is seizure-free, there's probably no real need to increase the dose, but just we can bear that in mind depending on how things go in the future. So that's phenobarbital. The next first-line treatment in epilepsy in dogs is imepitoin. That's sold as the trade name is Pexion. Now, this is a more recent drug, and I remember when it first started to be used in 2013, so I'm kind of dating myself there. It has been shown to be just as effective as phenobarbital, with the benefit being that there are generally fewer side effects. And again, those are generally temporary and include increased appetite, which is probably the most common one. Imepitoin also kicks in a lot faster than phenobarbital. So, what's not to love about that? Well, it's not, unfortunately, a drug that is available in every country. And where it is available, Pexion also tends to be significantly more expensive than phenobarbital. And that is a cost which can really add up over the lifetime of your dog. So where do these two drugs sit in the pecking order? Well, my take is that both phenobarbital and imepitoin, they're both really good starting treatments for the majority of epileptic dogs. If cost is no issue, or if I feel that there is a real need for that treatment to be working as quickly as possible, then Pexion is generally what I reach for. For every other dog, it's likely to be phenobarbital that I prescribe. So then the next most common anti-seizure medication, at least that I use, is potassium bromide. So there are a few big differences with this option compared to the others which I've discussed. And the first is that this is not really a first-line treatment, nor is it a drug that should normally be relied on for use by itself. And this is because it's not nearly as effective as either the phenobarbital or the imepitoin at reducing seizure frequency. The other difference is that it does take a long time to build up in the blood, to reach those therapeutic levels that are needed to control seizures. In fact, it can actually take 3 months to reach a steady state within the blood. To get around this, we actually can start by giving a higher dose, although some dogs unfortunately won't tolerate that. They'll develop nausea and vomiting, although giving it with food can help, and so we can't do that loading dose. But either way, it takes a long time to start working. The other more common side effects, which should all be familiar by now, are sedation, wobbliness, and increased appetites. And again, they do tend to go away with time. More serious issues, thankfully, are very rare, but they can include a change in personality with aggression or hyperactivity being concerns, and also an increased risk of pancreatitis, although again, that is a rare occurrence. Now, all of this means that on the surface, potassium bromide, it doesn't sound like a great option for treating epileptic dogs, but that is not true at all, because where it comes into its own is as an additional treatment. So used in those dogs which don't have a good level of control with either phenobarbital or imepitoin. So that's something that we can refer to as drug-resistant epilepsy. So this drug is used in addition to those two first-line treatment options. With phenobarbital especially, potassium bromide has what we call a synergistic effect. So its addition can help to either eliminate or significantly reduce seizure frequency by over 50% in 6 out of 10 dogs who don't respond to phenobarbital alone. So that might sound like not actually that many dogs it's helping, but it's over 50%. And remember, these are dogs with serious seizures that aren't responding to that first-line treatment. So it is a really useful addition. Now, the next pharmaceutical option is actually a drug whose name I really struggle with. It's a real tongue twister. I'll leave it here. We'll call it Keppra, that's the trade name. And again, this is typically an adjunct additional treatment used in drug-resistant epilepsy, although in some animals, it may be that they are started off with Keppra as their initial first-line treatment. So similar to the bromide, the response rate to Keppra is reported to be in the region of about 57–60%. So maybe not quite as good as the Pexion, imepitoin, or the phenobarbital. It is, though, a drug that is generally very well tolerated, and it's got a really favourable safety profile. So mild side effects we can see, again, sedation, ataxia, so that's wobbliness, decreased appetite and vomiting, with more serious side effects actually being very rare indeed. So this can be a great option for those where we're worried about side effects with those other drugs. Now, in terms of administration, though, there are a couple of issues with Keppra, and these are that it needs to be given 3 to 4 times a day, and that's something that clearly won't be possible for every single dog owner. The second issue with giving it is that some dogs will develop a tolerance to the drug over time, something to be aware of if your dog is doing well on Keppra, but seizure control then kind of seems to be slipping. And then to round out the different pharmaceutical options, there are the much less commonly used options. So if you're using these, then it's likely that you'll be working with a neurologist. As it suggests, if you're on these, the tried and trusted options simply aren't working. So zonisamide is our first kind of more unusual anti-seizure medication. This is actually licensed for treatment of epilepsy in Japan, but good evidence seems to be lacking as to its true benefit or otherwise. Care needs to be taken with regards to kidney and liver function, and it's not available in every country, and where it is, it can be incredibly expensive. Gabapentin and the related pregabalin are used to treat epilepsy in people, but their benefit in dogs is questionable, with very few studies available, and they consist of a handful of patients and they show unreliable results. So where we tend to use these drugs are gabapentin or pregabalin can either be with trying to manage chronic pain, so often arthritis, or some behavioural problems. But epilepsy, they don't really seem to have much of a role to play. Two other options which have also been looked at in limited studies without convincing results are felbinamate and topiramate, and really these round out our drugs used to treat epilepsy in dogs. Now, before I move on to the other options that can be used to help treat epilepsy in dogs, there are a couple of important things to consider with any drug treatment. So these are generally lifelong treatments, and stopping them suddenly or reducing their dose without guidance can actually trigger severe seizures, which may be life-threatening. So if you're going to make changes, make sure it's under the guidance of your vet. The next is that regular monitoring blood test is really important, not just to check the blood levels of the drugs in case of the phenobarbital or potassium bromide, but also to check general body health and ensure that we're not getting any serious side effects starting to occur. This is even more important when several drugs are being given at the same time, or we have different conditions to epilepsy. Arthritis would be an example, and we're giving multiple different drugs. We really want to check that there's going to be no drug interactions causing problems. And then dietary factors like salt content, diarrhea, vomiting, they can all affect drug absorption. So keeping a diet constant and making any changes slowly, and as well as addressing any intestinal upsets quickly, are really important for epileptic dogs. And I know this can all feel like a lot to take in, and every dog's situation really is unique. And that's exactly why I built an interactive tool that gives you the guidance, personalized guidance for managing your dog's epilepsy. It helps you feel confident in every decision, reduces the stress and uncertainty of the process, and ultimately gives your dog the best chance of living a happy, full life despite their epilepsy. Because great news here, most owners of epileptic dogs feel that their dog has an excellent quality of life and they have a full and normal life expectancy. So this tool is the next best thing to having a vet in your pocket, guiding you step by step through each stage of their journey, kind of having conversations back with you to allow you to work out what is best for you and your dog. Now, it is a premium resource, but if you want to learn more, then I've left a link down in the description below. Okay, so we're moving on to alternative treatment options now, our non-pharmaceutical options. So some of these are newer, some have been around for a while, and all have a certain degree of evidence, albeit potentially kind of very limited evidence at the moment, to support their use in reducing seizure frequency and severity. That being said, and a word of caution though, none of these options have been shown to be anywhere nearly as effective as our first-line drug options. You also need to know that prompt, effective treatment of epilepsy improves the likelihood of effective long-term control. So what that means is that if we are trying these alternatives instead of drugs and the epilepsy is getting worse and worse, we're going to compromise our ability if and when we then start drug treatment to successfully control those seizures. So in my mind, this means a couple of things. For dogs who have had any form of significant epileptic seizure in terms of frequency or duration, these alternatives are all options to add to conventional treatment with the aim to try and improve the chance of good control being achieved, potentially even seizure-free status being achieved. It may also mean that we are able to have a lower dose and with reduced need for additional pharmaceuticals if we're using these options. Using these options alone without pharmaceuticals runs the risk of delaying that effective treatment, increasing the risk of serious seizures, and compromising the ability to achieve long-term control. That being said, for dogs who have only had one or two, very short seizures, maybe there's been a long time frame between them, they might not otherwise be likely to benefit from starting traditional treatment because we don't start traditional treatment at the first short seizure. But these alternative options are great options to try because they may help prevent your dog's situation from developing further, or they may delay the time needed before you then do need to start more conventional pharmaceuticals. They may even stop your dog's seizures completely. And the other place that these alternative options have is if your dog experiences really severe side effects to traditional pharmaceutical options. Something that I really have to stress is rare, but it's not zero. These alternatives are a great option to try in their place. And I'll also leave links to all of these options in the description to this video if you do want to check them out further, along with that epilepsy tool that I spoke about. So the first of these alternative seizure treatment options in dogs is medium chain fatty acids. So these are metabolized differently compared to our long chain fatty acids, and they lead to something called ketones being produced. So these ketones can then serve as an alternative fuel for the brain. They have the potential to stabilize neuronal activity and so reduce seizures. Basically, they're feeding the brain in a different way that can kind of bypass the short circuitry that happens in epileptic seizures. So one small study looking at the impact of feeding a diet, which is Purina ProPlan NC NeuroCare, which contains 6.5% medium chain triglyceride oil. So dogs in this study, they had been treated for epilepsy for at least a year and had to have experienced at least 3 seizures in the 3 months prior. So they'd been treated, but they were still having seizures. And the results of the study were that 10% of these dogs became seizure-free and 43% had a reduction of over 50% in seizure frequency. So that is a really significant result, albeit in a small number of dogs. Another recent study of a small number of dogs, also with this drug-resistant epilepsy, showed that 18% of dogs that were given these medium-chain fatty acids as an additional treatment had a greater than 50% reduction in seizure frequency. 43% showed a seizure reduction of less than 50%, but 40% of dogs had no change or an actual increase in seizure frequencies. So they certainly didn't benefit every single dog, but 60% of dogs who had this diet still a reduction in their seizure frequency. So these are small studies. They're also run on epileptic dogs whose seizures are poorly controlled with medication. So what we really want then to know is, and what we really want is further research with larger sample sizes, longer durations to confirm these results, and also to explore the effects in dogs with less drug-resistant epilepsy. So what happens when we feed this diet to dogs who have epilepsy and have not received any medication or seem to be pretty well controlled on something like phenobarbital or imepitoin? Really we need that information before we can recommend this as a starting option for our dogs. Now, practically, there are a few considerations here too. These are that there are only a small number of diets like the ProPlan NeuroCare available that have been formulated to incorporate the levels of these medium chain fatty acids that's needed. An alternative is that these fatty acids, they can be added to the diet in the form of an oil supplement that contains high levels of caprylic and capric acid, so known as C8 and C10 MCTs. So this is not just plain coconut oil, but specially formulated supplements. So something like acrylic from Vet Plus. Now, in terms of dose, we're talking about giving the amount of oil that provides 9% of the energy requirements of a dog. So depending on the product, of course, each meal is going to provide about 7 to 8 calories. So we're talking about 1.5 teaspoons of oil for every 10 kilograms or 22 pounds body weight. Remember as well that any supplement or diet change needs to be carried out very slowly for dogs on any anti-seizure medication. And these supplements, they're not going to be appropriate for all dogs. And really stress this because it's going to depend on their history. And I definitely check in with your vet first. So a dog who's had pancreatitis in the past, you really would need to be very, very careful about adding oil to their diet. You're also going to need to reduce their normal diet by 10%. Otherwise, they're going to gain weight and become obese, and that is going to be a certainty. Now, our next alternative option is another fatty acid, but we're talking about our omega-3 fatty acids. So they may be beneficial to epileptic dogs, specifically our EPA and DHA, which are found in oily fish, krill, green-lip mussel, and other marine sources. So rather than our rapeseed, linseed oils, for example. So our omega-3 fatty acids, they have a natural anti-inflammatory effect. We use them a lot for things like arthritis, where they're fantastic, really beneficial for allergic dogs as well. And they're also believed to influence the lipids, so the fat composition of cell membranes, which affects the neurotransmitter function and ion channel activity within the nerve cells as well. So evidence of benefit, though, for epileptic dogs is harder to find than with our medium chain fatty acid supplementation. But there is some evidence that omega-3 fatty acids can reduce seizure activity in dogs, and even that feeding them to puppies may help protect against developing epilepsy later on in life. So that's something to think about if there's a family history of epilepsy, because we know there is a genetic link, genetic pathway for this disease. There's also some evidence to show that these supplements could help to reduce seizure frequency in epileptic children. So not dogs, but we're all mammals and we all work, in fairly similar ways. Now, I wouldn't supplement with both medium chain and omega-3 fatty acids because the levels needed would mean that they'd actually need to make up too much of a diet's calories, and there's going to be the potential to run into some quite serious issues potentially. Instead, what I would generally suggest reaching, or when I would suggest reaching for our omega-3 fatty acid supplements, is in those dogs who don't tolerate our medium chain fatty acids, or where they've been tried without maybe any change in that seizure frequency or severity. Also, where there are other conditions where omega-3s have a superior benefit. So if your dog does have any form of skin disease, if they have arthritis, or even if there's not a medium chain fatty acid supplement available to you because of where you are in the world. As for the dose, so a good place to start would be 100 milligrams per kilogram of EPA and DHA combined. So that would be 450 milligrams for a 10-pound dog and 2,500 milligrams for a 25-kilogram dog. Again though, build this up over a few weeks, reduce the amount of food that you're giving as well, and double check with your vet that there's no reason not to be starting these fatty acids. And then our next anti-seizure treatment alternative is CBD oil. So CBD, you're going to have heard about this. It's gained lots of attention over the past few years as a potential treatment for a really large number of different diseases. So in this case, we're looking at its potential anticonvulsant properties. So research has indicated that CBD can alter nerve activity as well as have an anti-inflammatory effect. And it may be that this is actually contributing to its anti-seizure effects. But is this just hype, or does the evidence back up the use of CBD? Well, one small 2022 study showed that about 43% of dogs showed a seizure reduction of greater than 50% when given CBD at a dose of 2 milligrams per kilogram twice daily. Another 2019 study showed a significant drop in seizure activity when dogs were given CBD. However, those given a placebo also had a similar number of dogs classed as treatment responders. So that's dogs whose seizure frequency dropped by half. This is why we need bigger studies than a handful of dogs each. Ultimately, I feel that there is some promise here, but possibly not quite to the degree that some would have you believe. And this is why for me, CBD oil is still very much an option to try in addition to those other more proven options rather than their replacement. But as always, further studies on larger numbers of non-drug resistant epileptic dogs would be great and help us to better understand where and how CBD and all of these other options can best be used. And then the final treatment option, in a way, is to reduce or eliminate exposure to the events that might be a trigger for your dog's seizures. So 3 out of every 4 epileptic dogs have an identifiable seizure trigger, which you can dive into by tapping on this video on screen now. So tap on that video to identify the seizure triggers for your dog. I'll see you there. And until then, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.